James Wall.
Jim, why don't you tell me a little bit about your care in the office? You've obviously been a patient here for a little bit, and I know things have gone well for you, so why don't you just talk to us a little bit about that? When you first came in with that injury.
I've been coming in here since '04, February of '04, and I've just been very, very happy with the success I had there.
You had an injury at work with the ice that came down, struck you in the back of the neck, correct?
Correct.
When that first started, and what were your, do you remember what your symptoms were? I mean, I certainly do as your doctor, but do you remember what your symptoms were when you came?
At the time, I had actually nerve damage, so I had severe headaches that I thought were sinuses, but it was actually my neck. And I had actually some twitching of the eyes and lips and stuff, which is all gone now.
You tried some other forms of care, right? Other than, before you came to see me, you were getting nerve blocks, I believe, and some other...
Oh yeah, I've had all the nerve blocks, all the conduction studies, just brutal stuff. Besides medications and stuff, and none of that really helped.
And the adjustments feel good here in the office?
Absolutely.
Yeah, and what would you tell somebody? Because I don't know if you were, I think you were a little skeptical when you first came in to a chiropractor, right? Or you didn't really know much about him, maybe. Is that accurate? Or?
Oh yeah, you hear things. Well, it's addicting and stuff. The way I look at it is addicting, just like eating and sleeping, as far as I'm concerned. I mean, I really need it. And, you know, if I go without it, I feel it. And that's basically the way I am. I mean,
The office has been good to you, the staff and so forth?
Excellent, very good, excellent.
And what would you say to somebody who's considering care, but maybe they're a little nervous or have the same kind of ideas that you did when you first came in, maybe you heard good or bad, and you're a little reluctant to come in? What would you say to them to maybe help them take that next step?
I just would say that you won't regret it. I mean, but again, it is a maintenance program. I feel once you get it started, it makes you feel so well and it helps you so much that you do have to stay on it. You'll want to stay on it and you'll have to. So you have to adjust yourself in order to stay on it, whether it's physically or financially or whatever. You've got to be able to do it.
Very good. Well, thanks. Jim, I've told you this before, but it's always a pleasure to work with you as your doctor, and I think a lot of you, and we've obviously had some laughs in here and very much enjoyed having you as a patient, so thanks for spending a few minutes with me today and just kind of sharing your experience with me. It means a lot to me, so thank you.
No problem, and I really appreciate what you've done for me, and I hope you sleep good at night because you help a lot of people, Doc.
Thank you, Jim. I appreciate it.